The one question men are most afraid to ask their urologist isn't about cancer or surgery. It's a whispered question laced with years of shame and misinformation. Doc, is this my fault? Is my masturbation habit damaging my prostate? For generations, men have silently feared that a normal part of their biology could be the very thing causing them harm. Today, we end that fear with facts. The truth is, your body is performing strange and specific biological changes when you ejaculate frequently. We're going to explore 3 of them, backed by science. The first is a profound defense mechanism. The second is a surprising hormonal shift. And the third is a critical warning that depends entirely on how you do it, and it can be the difference between long-term health and chronic problems. This is the conversation you need to have. Let's get started. Before we dive in, let's get on the same page. What is this gland we're so concerned about? The prostate is a small, walnut-sized gland that is part of the male reproductive system. Its primary job is to produce a milky white fluid that mixes with sperm to create semen. Because of its location, wrapped snugly around the urethra, the tube that carries urine from the bladder, any change in the prostate's size can have a dramatic effect on urination. As men age, 2 main things can go wrong: benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement, and second, prostate cancer. So the billion-dollar question is, how does a frequent, even daily habit of masturbation impact these processes? This brings us to our first and most important change. Imagine a small factory with tiny winding pipes. Over time, waste products, old materials, and chemical byproducts can build up. Your prostate is like that factory. Its job is to produce and secrete fluid. When it's not doing that job regularly, things become stagnant. The prostatic ducts can accumulate old cells, metabolic waste, and potential carcinogens that may have entered your body from your diet or the environment. This idea is called the prostate stagnation hypothesis. It suggests that allowing these substances to sit around for long periods can lead to chronic inflammation, a key driver of both BPH and cellular damage that could eventually lead to cancer. This isn't just a theory. A landmark study from Harvard University followed nearly 32,000 men for almost 2 decades. The results were stunning. Men who reported a high ejaculation frequency, defined as 21 or more times per month, had a risk of developing prostate cancer that was about 33% lower than men who ejaculated only 4 to 7 times per month. In population studies, a risk reduction of that magnitude is considered highly significant. This is the first profound change. Regular, frequent ejaculation acts as a physiological flushing mechanism, a cellular spring cleaning. Each time you ejaculate, you are clearing out those ducts, expelling old cells and stagnant fluid. You're not letting trouble brew. Now, let's dispel a major myth. Many men worry that frequent masturbation will drain their testosterone or throw their hormones out of whack. The reality of what happens hormonally is our second strange change. It's not about draining a tank, it's about recalibrating the system. Let's talk about DHT, or dihydrotestosterone. DHT is a potent male hormone, converted from testosterone by an enzyme called 5-alpha reductase. In adult men, high levels of DHT within the prostate gland are a primary driver of BPH, as it signals the cells to multiply. In fact, some of the most effective medications for BPH work by blocking that very enzyme. The act of ejaculation does not cause a long-term drop in your overall testosterone levels. The more intriguing change may be happening locally. By regularly flushing the prostatic fluid, which contains hormones and metabolic byproducts, you may be helping to regulate the local concentration of DHT and other growth factors within the gland itself. Think of it as preventing a buildup of these powerful growth signals. This isn't about depleting your manhood. It's about helping your prostate manage its own sensitive hormonal environment more effectively, creating a more natural ebb and flow. So far, the news has been surprisingly positive, but we cannot have this conversation without a critical warning. The first 2 changes are about the frequency of ejaculation. This third change is about the method. And this is where the habit can go from being protective to being actively harmful. I'm talking about a phenomenon urologists call the death grip. For many men, masturbation becomes a rushed, high-tension activity using a tight grip and aggressive stroking. Over time, your nervous system adapts. You are effectively rewiring your pleasure circuits to require an extreme level of stimulation, which leads to two serious problems. First, penile desensitization, which can make partnered sex feel unsatisfying and lead to delayed ejaculation. Second, and crucially for our topic, pelvic floor dysfunction. When you use this aggressive technique, you are clenching your entire pelvic floor, the sling of muscles that holds your bladder and prostate. This muscular straitjacket around your prostate can create a weak stream and urgency even if the gland itself hasn't grown significantly larger. It creates a state of chronic tension that directly irritates your prostate and mimics the symptoms of BPH or prostatitis. So the strange change here is a negative one. You are training your pelvic muscles to live in a state of chronic tension. This is absolutely critical. You must unlearn this habit. The goal is to shift to a pleasure-focused, relaxed experience. Always use lubricant. Consciously focus on keeping your jaw, stomach, and pelvic muscles loose. Breathe deeply. Use a lighter touch, and focus on mental arousal and imagination, not just pure physical force. This isn't just about better sex. It's about undoing a neurological and muscular habit that could be causing you chronic pain and urinary problems. So, what are the strange changes in the prostate of men who masturbate daily? 1. A positive change. A regular flushing that clears out stagnant fluid and lowers the risk of prostate cancer. 2. A neutral to positive change. A subtle recalibration of the local hormonal environment. And 3. A potentially negative change. A neurological and muscular rewiring that creates pelvic floor tension, if done with an aggressive technique. It's clear that the act itself is not the enemy. In fact, performed correctly, it is a healthy, protective part of male physiology. The danger lies in compulsion and in poor technique. If masturbation is something you feel compelled to do, if it interferes with your daily life, that's a sign to speak with a therapist or a doctor. But for the vast majority of men, the takeaway is this. Regular, relaxed, mindful ejaculation is a net positive for your prostate. The shame that has surrounded this topic has done men a great disservice. The fear so many men have can now be replaced with knowledge. You're not causing the problem. You hold the power to be part of the solution. By understanding these changes, you can make choices that serve you. You can embrace the cellular spring cleaning, understand the hormonal balance, and commit to a healthy technique that protects you for a lifetime. This isn't about a magic number. It's about consistency, health, and a relaxed approach. It's about listening to your body and treating it with respect, not shame. If this conversation has shed some light on a topic you've wondered about, please give this video a thumbs up. Subscribe for more science-backed health information, and share your thoughts in the comments. We can remove the stigma one conversation at a time. Thank you for your time and your courage to learn. Be well.